Hello, I'm Jamie Steele, and I'm a student nurse at Jackson College. My presentation today is a requirement of graduation in my NRS 240 capstone class. The purpose of this presentation is to summarize my evidence-based research paper titled Effects of Music Therapy in the Elderly Dementia Population. This paper was written to answer my PCOT-developed question, for elderly clients with a diagnosis of dementia, what is the effects of music therapy in comparison to the usual treatment on aggressive behavior? This is a therapy type question which looks at the benefits of music intervention in comparison to the routine care of the dementia population. Many studies have been conducted around this general topic, and many concluded while there is positive outcomes, the true statistical benefit is inconclusive due to varying documentation, inconsistencies with treatment, concerns of validation, and subjective opinions. One study explained how agitation could be quantified with the use of a grading scale known as the Cohen-Mansfield Agitation Inventory, or the CMAI. According to the Journal of American Geriatric Society, the CMAI score decreased a full 10 points, from 61.2 to 51.2 when used for an individual music program delivered during early signs of agitation. Patients with dementia is a growing population and a concern for an already stressed healthcare system in long-term care facilities. One trial identified that the benefit of music therapy was valid, but the staff did not believe it was feasible to continue sessions permanently. They stated staffing would need to be increased to help run the sessions due to the time constraints of basic care needs with the facility and the other patients. With the current staffing shortages in healthcare, I'm sure that we could all see how this could be a problem. Another study touched on how medications were used to treat aggression in dementia patients, but it's not without the negative effects such as drowsiness, risk for falls, and lower cognition. These trials intended to stop the frequency of the use of the pharmacologics. However, they are hoping to validate how music could help curb the attitude of the patients and help with some of the frustrations that they were experiencing. In conclusion, it surprised me the amount of research and data with the numerous trials were all unable to fully prove the benefit of music therapy. While the trials seemed to all come to an agreement that there were positive outcomes, they all seem to say that there's too many variables and inconsistencies with the documentation and treatment interventions to officially state the benefit. All of the studies did, however, note that there is benefit in continuing research and that the therapy group, hopefully with stricter guidelines and more adherence could eventually prove beneficial. Thank you for your time.